everyone, and thank you so much for joining today's special topic webinar, The Advocate Inside of You, Helpful Tools to Combat Today's Patient Challenges. My name is Carla. I am the Director of Education at NeedyMeds, and before we get started, I want to go over a few tips. You can type any questions you may have into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your specific question, we will follow up with you personally via email by tomorrow. But of course, we'll provide the contact information for both NeedyMeds and the U.S. Pain Foundation. This webinar is being recorded, and we will convert it into a video to be available for viewing on the NeedyMeds YouTube channel. And you can download a copy of today's PowerPoint presentations in the handout section in your GoToWebinar control box. If you have trouble with that, let me know. You can send me a message via chat, again in your GoToWebinar control panel, and I'll be happy to email you the presentation. So with that, let's get started. For those of you that are not familiar with NeedyMeds, we are a national nonprofit organization. On your screen now is our mission statement that we updated in 2016. Again, NeedyMeds is a national nonprofit, and what we do is we connect people to programs free and anonymously through our website and toll-free helpline that will help them afford or save on their healthcare expenses. And as you can see up on that screen, a big part of our mission is educating people. And we really define that education portion of our mission in two ways. One, by educating people about NeedyMeds and the resources we have to offer, but by also letting them know about other ways to stay healthy, which is why we are so pleased to have an expert from the U.S. Pain Foundation here with us. So let me do an introduction of our guest, Shana Smith. Shana joined the U.S. Pain Foundation towards the end of 2010 as a pain ambassador. And at the time, Shana herself was actually experiencing pain throughout her entire body without a diagnosis or treatment plan in place. Longing for compassion and understanding from others in her shoes, she learned of the incredible work and programs offered by U.S. Pain. Finding a support system and resources from what she describes as a professional yet welcoming nonprofit allowed Shana to move forward in her pain journey with confidence and validation that she wasn't alone. And it also allowed her to move along in her career to the current position she holds, which is again the Director of State Advocacy and Alliance Development. And you can see why her personal and professional lives have made her the expert that she is today. And we're so pleased to have her share her expertise and tips on how to be your own advocate. So without further ado, I'm going to hopefully seamlessly pass the mic and the screen to Shana, so bear with me while I do that. And Shana, you should be able to go ahead and grab the screen and begin your presentation. Everybody enjoy today's webinar. And again, if you have any questions throughout, you can type them into the questions section of your GoToWebinar control panel. Thanks so much.
Thank you so much, Carla, for that incredible introduction. And I'm so pleased that we have so many attendees this afternoon for what I consider to be a very important topic, which is really learning to become an advocate once you are given a diagnosis and or have a chronic illness, or if your loved one and your caregiver has a diagnosis. So as Carla said, we really are going to dive a little bit deeper into what it means to become the advocate inside of you, and really try and give you some general information relating to ways that you can really take charge of becoming your own best advocate despite today's various patient challenges. You'll see here I've outlined various goals for this afternoon's presentation. One of them is to empower at least one person. Now remember, it really truly does take one voice to start making positive changes within the chronic pain community or your own local community. Of course, if I can empower more than one person during today's webinar, that would be fantastic. I'm also hoping to encourage the attendees to build a new or even build off of an existing health advocacy plan. And I'll get into what that means in a few moments, but just know and keep in mind, you are your own best advocate And I'm sure you've already heard that saying before, but it is absolutely true, and you'll learn to value this trait as you seek out ways to enhance it. I put educate on there as a bullet point. I really want the attendees to be educated today on various topics that I'm going to be sharing, and I'm also going to be sharing a general roadmap of what it means to advocate for your health. I'm also going to suggest various activities that you can engage in, so it will be up to you as to how you choose to use the information that I'm sharing today. I'm really leaving the ball in your court. Finally, I did put this here as a little bit of a joke because I'm just a quirky person to keep you awake. In all seriousness, we do need to be really vigilant when it's coming to decisions being made by outside parties. And what I mean by that are insurers, state and federal lawmakers, government departments, all of those outside entities. It's going to be up to us to be alert and to be aware of how decisions from those made in doctors' offices to those made up on Capitol Hill could impact our treatment plan and really our overall quality of life. So I'm going to just pause for a moment. This is a little thinking exercise. I want to really have you take a moment and reflect on what does it mean to advocate for your health. I have come up with a few different definitions on what advocating for your health means. The first is being proactive. So let's say you have new symptoms, or if a medication or treatment regimen that you had been using in the past isn't providing you with satisfactory results. Health advocacy really means that you've taken notice and now you're taking charge of your life. Take charge. So while many of us here today have nothing but respect for those who have entered into the healthcare profession, it's okay for us to still question why a treatment option is being offered, why a medication is seeming less effective, if there are some other options to consider, and so on. So advocating for your health really means you're the driver. So you are behind the wheel, and members of your health team are the co-pilots. So we're helping you navigate down your pain journey, and you value their expertise and support, while at the same time recognizing at the end of the day, this is your journey. And sometimes you need to be thinking outside of the box and lending your expertise as well. Remember that no one knows your body, your mental, emotional, and your physical makeup like you do. Advocating for your health also means knowing that you have options. So I'll be going into a few options that you as a patient have when it comes to insurance companies and developing treatment plans with your doctor. I'll also go over how you can get involved with state advocacy initiatives or even start your own effort to see to it that your state has some protections in place. And again, we'll get into ways you can take charge and pursue those options during today's talk. Lastly, it also means fighting for your best interest. So I put this in here because at times it's not easy to reach the outcomes that you're striving for within your treatment plan. It truly can be a battle. But you should never settle for less than what you deserve, which is really to live life with pain and not in pain. And that's really what U.S. Pain Foundation has taught many of its pain warriors, including myself. And it's truly a positive way of thinking that can carry into how you're perceiving your pain journey. There may be times when you have to disagree with specialists, urge them to take maybe alternative action, and demand that something be handled a specific way so as to not cause further complication towards your condition. And it's okay to speak up and to speak out. That's why we have our vocal cords. So I'm going to start with, I really broke this presentation down into a few different pockets, if you will. The first, how to advocate for yourself scenario is here in the doctor's office. So the appointment itself, when you see your doctor, is mostly spent on discussion and what we'll call the medical interview. And that interview has three functions, as you'll see here in this slide. Gathering information, developing and maintaining a therapeutic relationship, and then communicating that information. So the patient-doctor relationship directly determines the quality and completeness of information that's shared and understood. If you and a healthcare specialist don't trust one another, or you're unable to disclose the information efficiently, then this partnership will fail. I did a quick research on the doctor-patient relationship and found an article that was interesting that said patients who are active participants within their doctor's office and ask questions, they do better biologically in quality of life, and they also have higher satisfaction. Okay, so we are going to talk about advocating for your health and developing your actual treatment plan as it relates to your medical appointment. So remember, this is in your doctor's office. So the first way that you can take charge of your health is by taking notes. Have you ever left your appointment and then you remember a question and you really wanted to ask your doctor, and now your appointment's gone and you're not seeing them, let's say, for another 3 months, 6 months, or even a year in some circumstances? This is why taking notes is so important. I know personally, I have so many questions when I see one of my healthcare specialists because I don't see them very often. So I do take notes. And there are times when I can't really describe how my pain feels to me, or even how frequently I'm experiencing high levels of pain or even specific types of pain. So I find taking notes extremely helpful for keeping track of those types of symptoms. So you can help your clinician better navigate you to more successful treatment options if you're providing them with as much information about your health as possible. Some examples of what you might want to disclose and include in your note-taking could be activities that your pain prevents you from doing, activities that your current treatment plan allows you to do, anything that may have lessened your pain and what may have made it worse, any side effects you're experiencing from new medications, things like that. So taking notes refers to symptoms. It also refers to jotting down information that your doctor has shared with you at the appointment. I can't tell you how many times I leave the doctor's office and maybe there were 3 or 4 recommendations that they made, and I remember 1 or 2 of them. And my husband asks how my appointment went, and I say good, and maybe I remember a few of his notes or suggestions, and I forget the rest. Some specialists will send you their follow-up notes and recommendations. Not all of them do. So this is why it's also a good idea to bring a notepad or even use an app. There are several of them that are out there for those of you that are more savvy with your cell phone or maybe a little tablet to really help you during those medical appointments. I put keep records here as well because I think there are a number of reasons why this is important, but a lot of times patients actually don't keep a file or a cabinet containing test results or surgery dates, even maybe some medication complication notes. So by having those resources on hand, it can really assist your caregiver in an emergency situation. And it also provides a roadmap for new members of your healthcare team or even existing ones, just to gain a clear picture of your pain journey. And maybe even consider having an advanced medical directive or even a living will, because this will help your family and you. It's also an extremely helpful and proactive form of self-advocacy. I'm just going to pause for a moment because we did have this situation come up actually a few times in our lives where record keeping was imperative to making sure that someone in our family was kept safe. So as Carla mentioned, I do have chronic pain. I have Ehlers-Danlos syndrome, hypermobility type. My son also has it. And oddly enough, my mother-in-law also has it. And she has really helped pave the way for really this presentation and has taught me how to self-advocate for myself. And so I do take some of her tips and tricks and use them in my own everyday life. But what was really helpful for us was a few months back when we moved closer to my in-laws, and we had requested that we have a copy of, some of her medications and what she would like us to do in an emergency situation. So we have a copy here at our house so that if we do need to be the primary caregivers in an emergency situation, we have that on hand, and we can talk with EMTs and doctors in the ER to really help them understand and advocate for her. So in some circumstances, record keeping is not just advocating for yourself, but it's helping you advocate for others. And I thought that that was a really helpful tool to have, was record keeping. Okay, so part of developing your treatment plan also means speaking up and asking questions while you're there with your clinician. So if you are experiencing a time-sensitive situation relating to your medical condition, make sure that you utilize the nurses and other staff within your clinician's facility. Maybe see if they can help you schedule an appointment with outside specialists. You really use them as a resource. If you have an appointment, but you're uneasy waiting for so long for that appointment to come, maybe call and ask if there are any available times to be seen sooner. You can also request to be on a cancellation list. I know that some offices don't have one, but others do. It's okay for you to speak up and to ask those types of questions. So again, remember when you might be feeling a little uncomfortable, speaking up and really taking a more proactive approach in your pain journey, just remember you're in the driver's seat and you need to always be thinking of ways that you can help feel better, get answers quicker, and manage your condition more effectively. It's not you being selfish, it's just you being smart. I put evaluate your care as another bullet point, but I'll just back up for one moment when we talk about speaking up and asking questions. So when you're in your doctor's office, just make sure you're making the most of that time by sharing any concerns that you might have about your health, any issues that have risen during your treatment plan, discussing any options that you may have learned about at a support group meeting or maybe even through your own research. It never hurts to ask, but it can literally hurt if you're not taking proactive action in the exam room when you're speaking openly and honestly with your physician. You can be shy outside of that room, but please, please, when you're in there and you've taken the time and energy to get yourself to the office, make sure that you've made the most of it because you truly do deserve it. Okay, so that's enough of my pep talk on speaking up and asking questions. So let's jump down to evaluate your care. So if you have had several unpleasant encounters with those who are supposed to be on your team when it comes to pain management or just management of any condition you're having, pain or not, maybe it's time to find another doctor. But remember before making that switch that you've given that physician a fair opportunity to maybe state his or her case as to why they may have been dismissing your concerns or why they're not taking a more urgent approach towards your health or why they're making the decisions that they're making. So doing so in a non-accusatory manner is going to prove more positive results. But if after taking that time to learn about your doctor's approach, if you're still feeling uneasy, then maybe it is time to find a new physician. I know some of you might be scared and thinking that that might label you as a doctor shopper. Again, it's just you doing your due diligence and taking that next step into doing what's truly going to be best for your health. Okay, so speaking of your health, I'm going to jump now and transition to a part of your pain journey where you're now ready to receive treatment options that were recommended by your doctor after speaking up and taking notes. But oftentimes people with chronic pain conditions, especially lately, are finding there are a lot of barriers to access in order to receive necessary care. So I have listed on this slide some examples of various barriers that people within the chronic illness community have experienced. And then I'll explain a little bit how to combat those challenges. So access barriers, these are various insurer protocols that were created to control costs on the part of the insurance company. So I listed step therapy, non-medical switching, and prior authorization as some access barrier examples. I won't go into too much detail about what each of those topics are, but I will just give a quick example of what step therapy is, just so you get an understanding of these types of cost-saving protocols. So step therapy is exactly what it sounds like. It may also be called fail first, because really your insurance company is really forcing you as the patient to fail first on a series of medications before receiving that originally prescribed medication from your doctor. Again, this is a way to save on costs. And then non-medical switching is when you've been on a medication for, however long, whether it be a few months or several years, and then all of a sudden your insurance no longer wants to cover it, or they've decided to place it on a more restrictive tier so it's financially inaccessible for you, and could create some non-adherence issues. I put denials on there with insurance companies, and some examples would be when your insurance is opting to not cover a medically necessary procedure or treatment options. I'll give a personal example that I felt and my doctor felt that maybe I should do a sleep study. My insurance felt otherwise because sleep studies are expensive for insurance companies. So instead they wanted me to do a home sleep study, which it was a little bit more cumbersome and inconvenient for me to have to go get all of the equipment and pray that I did it all right and I hooked myself up. But that's another example of when an insurance is deciding not to cover something that your doctor has stated is medically appropriate. All right, so know your rights. There is action that you can take if your health plan decides not to pay for your treatments or if your carrier is delaying your care. So there are some state and federal laws in place that may protect you from those harmful practices that I just mentioned, step therapy, non-medical switching, things like that. And we'll get into that more when we look into advocating for your health at the legislative levels. But here, let's take a look at these 3 key ways that you can champion for better care of your health. One is you can appeal a decision that's made by your insurance company. So you need to know that you do have the right, always have the right, to an internal appeal. You can ask your insurer to conduct a full and fair review of its decision. And here's how. The first is to collect any letters that your insurer has sent to you. So that's going to be the letter that notes why they've denied your claim. Then you call your healthcare provider's office because they usually, more often than not, have people dedicated with this type of situation. So they have staff members usually helping with this appeals process. And they can really advise you on how to fill out an appeals form, how to write appeal letters, or even write the letter on your behalf. Now, as great as my son's pediatrician is, he did actually state to us early on that the patient's family in his practice typically is the one that will send out the appeal and the letter. And then his office can get involved if need be. So if it comes back and they decided to deny that appeal. So in our case, we ended up writing our own letters on our own, actually one for my son and one for me. Submit the appeals request and then expect to wait maybe 30 days to hear back from the insurer. It can take up to 60 days if you receive the treatment and now you're waiting to be reimbursed. But make sure that you're following up during this time period with your insurer until you're hearing back from them. This is another good scenario or, another great time when you should be keeping a record of the date, maybe the time, and even the representative that you spoke with. So the second bullet point is to request an external review. So if your insurer denied your coverage on appeal, under law, know that you're entitled to take that appeal to a third party for what's called an external review. And that means your insurer does not get the final say over whether to approve a treatment or to pay a claim. So keep in mind that with this option, you can skip the appeals process altogether, especially if you find yourself in an urgent health-related situation. So in other words, if waiting 30 to 60 days would in some way jeopardize your ability to regain your function or even your life, this would be the route for you to go, is the external review process. And by going this route, your insurance commissioner or attorney general is assigning someone to research, investigate, and even resolve your complaint. And that person examines the records, and they might question witnesses or even hold a hearing. If the insurance commissioner or AG finds your insurer did violate laws or any regulations, then they may order the insurer to cover your requested treatments or compensate you. That last bullet point down there is to file a complaint. So you also always can file a complaint by visiting one of our allied organizations' website. One is Aimed Alliance. They have a newer online tool. It's called coveragerights.org. And you'll want to file a complaint, especially if you're still experiencing some problems after the external review. And that complaint should include everyone that's been involved in your case. Again, remember the policy number, the dates of denial, the reason for the complaint, and also what you consider to be a fair resolution. So let's talk a little bit about ways that you can advocate for your rights at the Capitol and on the Hill in DC. Obviously, you can get involved. So in order to learn about whether your state has patient protections against insurance barriers that we've discussed, or maybe some that we haven't discussed, please visit our website and you can find out if there are protections by searching your state or searching by an issue. If you're finding that your state doesn't have strong enough protections or any protections relating to patients receiving their meds timely, or learn complementary therapy options that you depend on do not offer reimbursements to those specialists like a chiropractor or an acupuncturist, you can get on the phone, send an email to your state representative, and request a meeting to discuss ways that your state can strengthen those protections for you. Now, US Pain can also help you through that process and even provide your representative with some model legislation to consider implementing in your community. You can also join Hill Days or advocacy events that are taking place in DC, where patient advocates have scheduled meetings with congressmen and senators. And usually those patient advocacy days are called to urge that lawmakers support proposed bills or even consider sponsoring a bill that we'd like to see filed at the federal level. After getting involved, you can testify. So going before a state committee is a great way to express your support or even your opposition to a bill that could impact your quality of life or even patient safety. By tracking bills in your state, you can pick and choose which ones you would like to become involved with. Again, US Pain Foundation has this state tracking tool available for you all to utilize. It is a free program, and you can also take a little bit of time by going to your own state's.gov website and starting to explore a little bit there what types of bills your state has coming during the existing or even an upcoming legislative session. Submitting letters to lawmakers and sending emails is just another way that you can testify if you can't be at a hearing in person. So remember, that's an option that you can submit a letter to an entire committee, and most state websites also make you aware of how to submit public testimony. And in almost every situation, lawmakers' email addresses can be found online. In some circumstances, they have a spot right on their homepage where you can send an email directly to them. You can also follow those same exact steps at the federal level, not just at the state level. Okay, so you can submit op-eds or letters to the editor, and this is really to increase your outreach. Please consider submitting an opinion piece or a letter to the editor on a bill that you'd like to see passed or a bill that would greatly hinder your ability to maintain your quality of life. So things that you might want to consider explaining in your article as well as when you go to testify is really your personal experience, either your pain journey or your journey with a chronic illness, and how a specific legislation would impact your life, your treatment plan, things like that. You can become a patient advocate. So I'm going to say I am a little biased when I say you can advocate for US Pain, but really please, if you are interested in becoming involved as a patient advocate, do your homework and choose a nonprofit organization that you truly feel is sharing the same philosophies as you when it's coming to patient rights. I will do a quick shameful plug here that we do have an advocacy network at US Pain Foundation that focuses on both state and federal issues. And really, the advocacy program is what you make of it. So we really tried to cater this program for all walks of life. And I'll use a perfect example that we do have the Jocelyn Badman Pain Ambassador of the Year Award. that's given to an advocate or just a volunteer who has really gone above and beyond the call of duty to empower patients across the United States. And Jocelyn was an incredible pain ambassador who had a myriad of pain conditions, and towards the end was diagnosed with stage 4 cancer. And despite her grim prognosis, was still able to advocate from her bedside. So we really try and take any guessing work out of the equation and to make steps as simple as possible for you to take some action. I did want to, before we jump into questions, just note that, as Carla said, I do have a chronic pain condition. So for me, advocacy is personal. For many of us at U.S. Pain Foundation, it is very much so. We are all fighting daily for ourselves or for loved ones. Every one of our directors at least has one chronic pain condition. And I just wanted to take a moment to explain a bit more about my son Landon and me. So hopefully you'll find today's information not only credible, but just provide you with a little bit of proof of how you can make a difference despite your invisible disease. So I was diagnosed with EDS and in 2015, which was 5 years after the onset of my chronic pain. However, we weren't new to this connective tissue disorder. As I said, my mother-in-law also has EDS, and she's helped us along the way with different information relating to this condition. So through years of conversation with my in-laws, we learned that even though EDS type 3 is considered the least severe, it can still involve a lot of different complications. So we learned there was a 50% chance of passing this condition down to any children that we would have. However, we had our son Landon before I was even diagnosed with EDS, and that's not to say we would have opted not to have a family, but we may have been a little bit more mentally and emotionally prepared for the health-related challenges that came our way. So for much of Landon's young life, he did show no sign of discomfort or medical complications. He was crawling before 6 months of age. He was walking before he was 10 months old. He was full of energy, imagination, and compassion, and he still is. And then as he started to get a little older, we did notice some hypermobility in his joints, but children are flexible, and we weren't really overly concerned with his ability to move those joints beyond the normal range of motion. A little over 1 year ago, Landon started complaining of aches in his neck and his shoulder and lower back. And since the start of Landon's journey, our family did have to make some minor adjustments. So because we're told it was possible Landon has EDS, we've been following each recommendation from his healthcare team, from taking specific vitamins to sleeping on a memory foam topper to preventing many dislocations. And we also felt important to reach out to our family and to Landon's school to join his health-related support network. So, for example, when he entered first grade, we notified the administration that classroom accommodations might be necessary, the dress code might be breached, and frequent absences might be expected. This year, when he was in second grade, we worked to get an approved 504 plan so that he can continue flourishing in school. So why am I telling you all this? Well, so these acts are all examples of advocacy, right? So I'm taking charge of my health, but in this case, because I'm a mother to a son who also has a chronic condition, I'm taking charge of his health as well. Because everyone really does deserve to have the best quality of life possible despite their condition and age. So while I live with pain daily, I really don't let it define me. Actually, it does surge my passion to speak up on behalf of others living with invisible illnesses and to really do presentations like this. So on days when my pain is heightened, I can still advocate on my laptop or my cell phone by emailing legislators and urging them to either support or oppose a bill. And then on other days, if I'm lacking energy to fly to another state and give testimony, I'm really not ashamed or embarrassed anymore to ask if there's a teleconference option available. I recently had to testify. Actually, I think I phoned in for a committee when I was traveling in Washington, and I was able to read my testimony in the comfort of my home. Another time I was traveling for U.S. pain work, and I had to telephone to a committee out in Alaska, and now that bill is actually ready to be signed by the governor. So, you know, taking small steps like making phone calls whenever you're able to goes a long way. So remember, you can make a difference no matter your disease progression. Again, I did bring up my dear friend Jocelyn, who has since passed away, who was a volunteer for us and was still providing advice for other advocates and submitting letters from her bed until she was no longer able to do so. So U.S. Pain and other groups make sure people from all walks of life can participate in advocacy efforts. For me, I advocate so my son has a better future with less barriers to access the care and treatments that he needs. And I really hope those listening today understand that you too deserve those same basic patient rights. So I will stop there because I have been talking for quite a while now, and I will hand over the microphone back over to Carla to see if we had any questions from the audience.
Shana, thank you so much for that thorough and really compassionate presentation. And I've said it in the introduction, but I do believe the combination of you being an advocate for yourself, an advocate of your son, and having a leadership role at the U.S. Pain Foundation, it really makes a difference. I think that combination of personal and professional experience. And what I always walk away, and I know this is titled, the presentation is titled The Advocate Inside of You. I always appreciate that you really do give real life ways for people to participate and advocate for themselves. I'm going to go ahead and encourage our audience. I do see some questions coming in. I'm going to go ahead and remind everybody that they can go ahead and submit any questions they may have into the questions section of your GoToWebinar control panel, and you can download my PowerPoint presentation and, more importantly, Shana's PowerPoint presentation in that handout section. While I do have you as a captive audience, I'll just remind you that here at NeedyMeds, we work pretty hard to make sure our calendar is chock full of special topic webinars we think our users and audience would be interested in. So there's a snapshot of the webinars coming up throughout the rest of the week. We actually have one, as you can see, again this evening. And you can sign up for these webinars and the NeedyMeds calendar events, which is easy to find because it's in the right bottom hand side of our homepage. And while I ask Shana some of the questions that are coming in, I'm going to go ahead and put up the contact information for U.S. Pain Foundation and, of course, NeedyMeds at the bottom of that screen. So, Shana, one of the questions that are coming in is, are there any helpful tools you would recommend when keeping track of symptoms or information to share at a doctor's appointment, for example?
Oh, good question. So I use a few. I have used a newer app called Ouchie that helps you keep track of your pain symptoms. It was just made available for both iPhone and Android users. And I don't always have a lot of room on my phone for downloading apps. I will blame my son again for that, wanting to download games on my phone. But what I have found is there, you know, a lot of the phones today have a note-taking program that it already comes with, and I use that. I think it's called Notes, and I have an Android. So I use the Notes. I actually found it extremely helpful when I was trying to track Landon's headaches and stomach aches because they were happening so frequently that I just couldn't keep track. And if I was on the go or we were somewhere as a family, that was what I found to be most helpful, was having something tangible and readily available. And I think for the most part, the majority of us today always have our cell phones with us. So I recommend maybe taking a look at different apps that you find might be most helpful for you, whether for symptoms it be Ouchie or just using a notes type of program. And then you have that information to carry with you at your doctor's offices. And I actually, what I did is I copied and pasted everything from my notes into my email, and then I printed that out for Landon's doctors, so it was there for them to see. And then it was also good for me as a mom to see if there were any specific triggers or trends that I could really pinpoint. Something else that I use that's not really a tool for note taking is a blood pressure tool, which I have downloaded. But that's because I have some blood pressure issues, and again, I don't always think to write it down somewhere, and usually I have 20 sticky notes on my desktop at once, and it could get lost. So again, I think that using modern innovative technologies such as different apps that are out there is probably the route to go these days, and the most helpful. And in some situations, like with that blood pressure app, I know I can download the information and email it to myself directly from that app.
Thank you so much, Shana. And I'm actually going to take an opportunity to mention something, and I'll probably follow up even with Shana personally offline. What I'm going to do is transfer out of the PowerPoint presentation, and hopefully you guys can now see the live NeedyMeds website. And what I really want to point out is, first of all, a couple of things. On the bottom right-hand side is that calendar of events that I was referring to, and that's where you can register for all of the upcoming NeedyMeds webinars. But I also want to take a moment. On the left-hand side of our screen, you'll see a box for the NeedyMeds Storylines mobile app, and this is actually a free self-care app that makes it possible for users to track and manage their health conditions. And it includes things such as a pain rating scale. You can also, in addition to tracking your own health and wellness symptoms or details, you can also do that for a loved one. And in fact, in September, and I'm switching over to the September calendar of events, we actually have a webinar coming up called Self-Care for Caregivers, where users will be able to become better acquainted with this app and learn how to use it to manage their own stress and health, as well as to be able to manage the health of their loved ones. So that was actually a great opportunity to share that NeedyMeds resource. So another comment actually coming in is wonderful, and I want to share it. We have an audience member that wrote in that said a nurse many years ago shared with her a really important statement, and Shana, I think you're going to love this as well, which is, don't forget that the doctors are the hired help. They work for you. And I do think that's something really important for all of us to remember, especially when we're talking about advocacy. Another question coming in is, we have an audience member thinking of becoming an advocate, but doesn't have any experience and want to know, will that put them at a disadvantage?
Oh, interesting. So I will tell you that I had zero advocacy experience. My background is actually in journalism, where I worked at a local radio station as a news director. And I think really the advocacy work found me, both because there was a need for it within the organization, but even before that need was apparent, it became clear for me in my pain journey that I really needed to do more in the way of self-advocacy. So I would say you absolutely do not need experience in order for you to sign up as a volunteer. And if you do sign up, we provide you with an advocacy toolkit. So right off the bat, you are given access to several pages of just different content and information, everything on how to testify, how to submit a letter to the editor, different legislative terms and different topics that we prioritize, so that way you feel comfortable and confident in the type of work that we do as an organization. And then even though you have that toolkit as a resource whenever you need it, I always encourage anybody to utilize me as a resource as well, because I want to make sure that you are feeling comfortable going into any situation where you're sharing your patient story and you're representing fellow pain warriors. So please don't feel discouraged in any way if you have no experience at all. Whether you know it or not, you actually do have experience if you are a person living with a chronic condition. You just probably haven't labeled it as such before, but you are already advocating.
Thank you so much. And I really can't stress enough how important it is what you said, Shana, that if you're living with this, a loved one is living with this, it's touched your life in any way, I think it's important to share your story because just that alone can make a difference. With that, we're going to go ahead and wrap up today's presentation. Shana, thank you, of course, so much for sharing your enthusiasm and your expertise with the NeedyMeds audience. And to people that joined us and took time out of what is no doubt a busy workday to learn a bit more about advocating for yourself, thank you. And again, we're working as quickly as we can to convert this webinar into a video to be posted to our YouTube channel. And we do hope to see your name pop up again at other future NeedyMeds special topic webinars. If we didn't get the chance to answer your specific question, you will hear from us by tomorrow afternoon. But don't hesitate, if you have any other questions, concerns, or comments, to reach out directly to either U.S. Pain Foundation or NeedyMeds at the contact information on your screen. Thanks, everybody, and have a happy rest of the afternoon. Take care.